Join us in this video as we explore the remarkable impact of Trulicity, a revolutionary once-a-week solution that has transformed the treatment of type 2 diabetes. Trulicity is the brand name for dulaglutide, a medication used to treat type 2 diabetes. It belongs to a class of drugs called glucagon-like peptide-1 receptor agonists, GLP-1 agonists. Trulicity is administered as an injection once a week and is used in conjunction with diet and exercise to help improve blood sugar control in adults with type 2 diabetes. GLP-1 agonists, such as Trulicity, work by mimicking the action of a hormone called glucagon-like peptide-1. They stimulate the release of insulin from the pancreas when blood sugar levels are high, which helps lower blood glucose levels. Additionally, GLP-1 agonists slow down the emptying of the stomach, reducing appetite and promoting weight loss. Trulicity has been shown to be effective in reducing HbA1c, promoting weight loss, and reducing the risk of cardiovascular events in people with type 2 diabetes. Trulicity can be used in the following situations. Monotherapy. Trulicity may be prescribed as a first-line treatment in patients who are unable to achieve adequate glycemic control with diet and exercise alone. Combination therapy. Trulicity can be used in combination with other oral anti-diabetic medications, such as metformin, sulfonylureas, or basal insulin, long-acting insulin, to enhance glycemic control. It's important to note that Trulicity is not recommended for the treatment of type 1 diabetes or diabetic ketoacidosis. Additionally, it is not a substitute for insulin and should not be used to manage diabetic ketoacidosis. Dosage. Trulicity is available in pre-filled pens that contain the medication. The standard starting dose for Trulicity is 0.75 mg once a week. However, depending on individual response and tolerability, the healthcare professional may choose to adjust the dose to 1.5 mg once a week or higher. Administration. Trulicity is self-administered as a subcutaneous injection. It is injected into the fatty tissue just under the skin of the abdomen, thigh, or upper arm. The injection sites should be rotated to minimize the risk of injection site reactions. The pre-filled pen is designed for single use, and a new pen should be used for each injection. Trulicity has specific contraindications, and its use may not be suitable for certain individuals. Hypersensitivity. Trulicity should not be used in individuals who have had a previous hypersensitivity reaction to dulaglutide or any of its components. Hypersensitivity reactions may include symptoms such as rash, itching, swelling, or difficulty breathing. Personal or family history of medullary thyroid carcinoma, MTC. Trulicity is contraindicated in individuals with a known or suspected history of MTC or in those with multiple endocrine neoplasia syndrome type 2, MEN2. MTC is a rare type of thyroid cancer. Personal or family history of multiple endocrine neoplasia syndrome type 2, MEN2. Trulicity is contraindicated in individuals with MEN2, as it may increase the risk of developing MTC. While Trulicity is generally well tolerated, like any medication, it can have potential adverse drug reactions. Here are some commonly reported adverse effects associated with Trulicity and strategies for managing them. Gastrointestinal effects. The most frequently reported adverse reactions are gastrointestinal in nature, including nausea, vomiting, diarrhea, and abdominal pain. These effects are usually mild to moderate and tend to diminish over time. Management. It is recommended to start with the lowest effective dose and gradually increase as tolerated. If gastrointestinal symptoms occur, they are often temporary and may improve with continued use. If the symptoms persist or become bothersome, consulting with a healthcare professional is advised. Hypoglycemia. When Trulicity is used in combination with other anti-diabetic medications that can cause hypoglycemia, such as sulfonylureas or insulin, there is a risk of experiencing low blood sugar levels. Management. Close monitoring of blood sugar levels is important. Ensuring proper coordination between Trulicity and other anti-diabetic medications is crucial to reduce the risk of hypoglycemia. It may be necessary to adjust the doses of other medications when initiating Trulicity. Be sure to discuss any concerns about hypoglycemia with your healthcare provider. Injection site reactions. Some individuals may experience injection site reactions, such as itching, rash, or swelling at the injection site. Management. Injection sites should be rotated to minimize the risk of irritation. If you experience persistent or bothersome injection site reactions, notify your healthcare provider. Pancreatitis. Rare cases of pancreatitis have been reported with Trulicity use. Symptoms may include severe abdominal pain that may radiate to the back, along with nausea and vomiting. Management. If you experience persistent, severe abdominal pain or symptoms suggestive of pancreatitis, seek immediate medical attention. Trulicity typically starts to show effects on blood sugar control and other parameters within a few weeks of starting treatment. However, the full benefits may take several weeks to months to become evident. Here is a general timeline for the effects of Trulicity. Blood sugar control, HbA1c and fasting blood glucose. Trulicity helps to lower blood sugar levels by improving insulin secretion and reducing glucagon release. While individual responses may vary, significant reductions in HbA1c and fasting blood glucose levels are typically observed within 12 weeks of starting Trulicity. However, it's important to note that it may take several months to achieve optimal blood sugar control. Weight loss. Trulicity is associated with modest weight loss in people with type 2 diabetes. Weight loss effects are generally observed within a few weeks to months of starting treatment. The extent of weight loss may vary among individuals, and it is important to incorporate a healthy diet and exercise regimen to maximize the weight loss benefits. It's worth noting that the response to Trulicity can vary depending on factors such as individual metabolism, baseline blood sugar levels, adherence to treatment, and overall lifestyle factors. Additionally, the effects of Trulicity may be more pronounced with longer-term use. Trulicity has been studied in clinical trials to evaluate its effects on weight loss, HbA1c, and fasting blood glucose levels in individuals with type 2 diabetes. Here are some results from different clinical studies. Weight loss. A clinical trial conducted with Trulicity as monotherapy showed that after 26 weeks, participants experienced an average weight loss of 2.6 kilograms, 5.7 pounds, to 3.1 kilograms, 6.8 pounds. Another study comparing Trulicity with insulin glargine found that Trulicity led to greater weight loss compared to insulin glargine over a 26-week period. HbA1c reduction. Clinical trials have shown that Trulicity effectively reduces HbA1c levels. The extent of HbA1c reduction varies based on factors such as baseline HbA1c levels and individual response. In a study comparing Trulicity to placebo, participants taking Trulicity achieved a mean reduction in HbA1c of 1.4% to 1.8% after 26 weeks. Fasting blood glucose. Clinical studies have consistently demonstrated that Trulicity effectively lowers fasting blood glucose levels in individuals with type 2 diabetes. Regular monitoring of blood sugar levels, HbA1c, and weight is crucial during treatment with Trulicity. It is important to follow your healthcare provider's instructions, attend regular checkups, and communicate any concerns or questions regarding the timeline of effects with them. Remember, Trulicity should be used as part of a comprehensive diabetes management plan that includes a healthy diet, regular exercise, and other medications as prescribed by your healthcare provider. Thanks for watching.